So we had something got past our cellular defenses, or we had some kind of tissue damage. We had that inflammatory response, and that is going to lead right into tissue healing. And the phases of tissue healing is what we're going to talk about. So in the text, there's a really nice logarithmic chart of wound healing phases, and there are some videos to watch about wound healing too, which are very useful. But the thing to notice about the wound healing phases is they overlap each other. They're not just discrete, like one ends and another one starts. There's a lot of overlap. So you don't always know exactly which phase you're in, but there are clues, and we'll talk about the clues. Same learning objectives. So we're going to talk about the stages of healing, which overlap each other, healing by primary versus secondary intention, and cell regeneration versus cell repair, and the results of that. So the stages of wound healing, the first stage, which is in the first 10 minutes of the wound, basically, and let's say that this is a big skin wound, we'll just say. So first, blood has to clot for hemostasis to keep you from bleeding out of the wound. And so you get vasoconstriction to help with that blood clotting, and then you get vasodilation to lead into the inflammatory phase, which is where the fluid and the neutrophils, the macrophages, and everything is going to come in. So that inflammatory phase starts about an hour after the initial wound injury, and it goes up to a month. So the inflammatory phase can last a pretty long time. The neutrophils arrive in the first 30 minutes to 2 days. So when we get vasodilation and we get fluid going to the area and the capillary beds open up, neutrophils are macrophages. I mean, they're not macrophages, sorry, they're phagocytes. They're cleaning up debris and they're cleaning up pathogens. After the first 2 days, the neutrophils, basically a neutrophil can eat one mouthful of something and then it's done. And then the next neutrophil eats another mouthful and then it's done. After 2 days, the macrophages, and macrophage means big eater, if you want to think of it that way, the macrophages come in the 2 days to a month, and they're really cleaning up debris. And not only that, they have a big role in the immune system, which we'll talk about in the next chapter, and they're fighting infection in that wound. So that in that inflammatory stage is really important for limiting the damage. Even though you might think, oh, inflammation's bad, it isn't. It leads to wound healing. Too much inflammation, yeah, that's bad, but we're going to lead into wound healing. So remember, we said 0 to 10 minutes, 1 hour to 1 month. So overlapping that inflammatory phase is the proliferation phase, which happens from 12 hours to 1 month. So fibroplasia, so we're growing fibers and granulation tissue, which is the new tissue that's going to replace the damaged tissue. We get angiogenesis, which means new blood vessels, and epithelialization. So if you've ever had either a surgical incision or a bigger wound, like I always think about wounds that I got while rollerblading, you know, skin meets pavement sort of things. And right when you have a new scar, it's pink, right? Because we have that new blood vessels we're developing, we're in the process of angiogenesis, and the granulation tissue is pink, and the epithelialization, it's new cells replacing the damaged ones. So our skin cells are pretty awesome because there's constant mitosis going on and they're always being replaced. And so you can get healing of the skin, which is really, really nice. Within a day to 2 years, so that's a really long time, you get maturation and remodeling of the wound. So it reorganizes the collagen and the strength gradually returns. Strength of the tissues is what we mean. So the tissues, if you have a big wound and scar tissues forming, the scar tissue strength will be at 50% from 2 to 12 months. So that in that remodeling stage, when you have like the new scar, the pink new scar versus the old scar, which is white, because the collagen has been reorganized. So initially, the body, the fibroblasts are creating collagen that's not as strong. It's just kind of trying to patch the holes. And then that collagen, through remodeling, gets replaced by stronger collagen, which is going to then hold you together indefinitely, hopefully. So, depending on the type of wound that you have, it might heal by either primary or secondary intention. So, primary intention or first intention, sometimes called, is the when you have a clean, straight wound with clean, straight edges. So think of like a surgical incision. There's minimal tissue loss because they cut through with a sterile scalpel, and the edges are brought together. And a lot of times the edges are brought together and sutured together so they're held together. And so a surgical incision or a nice clean cut is going to heal faster with minimal scarring because the edges of the wound are well approximated. They're close together. With secondary intention or second intention, they'll sometimes call it, it has irregular wound edges, significant tissue loss. So this is your you wiped out on your bike and you have major road rash and there's like gravel embedded in it and you've lost a lot of tissue and the edges aren't together. It might be infected or there might be foreign material in there. So like burns, pressure ulcers, infected wounds, um, and they heal slower and there's more scarring. You have a broader scar. So when the tissue is healing, you can, if you lose or damage cells, it can be replaced by the same type of cell, which is called regeneration. If different types of cells replace the lost cells, the process is called repair. So I was saying that the epithelium of the skin regenerates quickly. So the example that's in the book, and this is an example that I always give, is a paper cut. So we've all had a paper cut. The definitely there's tissue damage. You might get some lost cells, but you don't have scars from a paper cut usually because the cells are completely regenerated and the normal function is restored. And that's best case scenario. It doesn't always happen best case scenario, but the if the lost cells can't be replaced, they're replaced by a different type of cells. It's called repair and scar tissue. And I always say scar tissue is the spackle of our body. So you get a hole in your wall at home and in your drywall and you put spackle over it and you sand it down and you paint it and it looks like the rest of the wall, but it's not. It's weaker and it's a different kind of tissue. It's a different material. The function might be a little bit impaired, um, but it depends on how much scar tissue there is. So heart muscle after a myocardial infarction, you're going to lose cells, they're going to die, and you get scarring with the coagulative necrosis like that. Scar draws in, and so you get less function. And a lung tissue after injury, that's another example where you get less function. Repair versus regeneration is more common with a more severe injury. So if you if you have just a minor injury like paper cut, those cells can regenerate, you're good to go within a little bit of time. It's funny at the hospital on the little hand sanitizer dispensers, people who think they're funny put labels on them that say paper cut detector. You put hand sanitizer on there and it stings, but it only happens like that for a couple days and then it's regenerated and it's normal. And then you don't even know where the paper cut was because the tissues were completely replaced. With repair and you have scar tissue, you do know where the cut or the wound was. I know I had a scar on one of my knuckles for a long time from when I was rock climbing a long time ago. I don't go rock climbing anymore, but I had my hand in a crack, I was using that for friction and it ripped out and I got a big scar on my knuckle and it was wound healing by second intention. And so for the long time I had that white scar tissue. Well, it was right on the good regenerative part of my skin and it did eventually over 40 years regenerate. which yay. And now I don't have a scar. And then you get, if you say you had surgery 10, 20, however many years ago, if say you had arthroscopic surgery, you might not even be able to find those little arthroscopy cords because they've healed so well and some of the tissue has regenerated. So the wound healing typically involves both types, regeneration and repair. So you'll get some scar tissue and you'll get some cells that will regenerate. Yay. The regeneration capacity of different tissues depends on whether or not you're going to get repair or regeneration. So some tissues like the epithelium of the skin, the intestinal lining, blood cells, liver cells have a high regeneration capacity. Liver cells are always repairing themselves, which is kind of cool and then can cause problems. We'll talk about that later. Next quarter when we talk about the liver. Some cells have pretty moderate regeneration capacity, like bone and smooth muscle, and some glandular tissue can regenerate fairly well. Some cells have either very low or no regeneration capacity, like cardiac muscle. Nervous tissue has zero, especially central nervous system nervous tissue. In the peripheral nervous system, it has low regeneration capacity, but it can happen. Skeletal muscle has limited regeneration capacity, so it's not no regeneration, but it's lower than some of the other tissues. And a lot of times, the regeneration capacity of the tissue depends on the blood supply. So I always say circulation equals healing. So if you have a tissue that has better circulation, better blood supply, it's going to heal better. Skin, great blood supply. Intestinal lining, great blood supply. Blood cells, they are the blood supply. So bone marrow has good blood supply. Liver cells, great blood supply. Bone, pretty good blood supply. Smooth muscle, same thing. Glandular tissue, absolutely, because that's how they get their products out to the rest of the body. Cardiac muscle has a good blood supply, but it has other issues, other reasons why it can't regenerate. Nervous tissue also good blood supply, but other reasons why it can't regenerate. And we'll talk in detail about that in another class. And then skeletal muscle, same thing. So there are things that can cause a low regeneration capacity. And next quarter, we'll talk about connective tissues and their regeneration capacity. And some are good and some are not so good. So when you form scar tissue, like I said, scar tissue is the spackle of your body. The scar tissue is spackle. It doesn't function like the original tissue. It doesn't regenerate and replace the cells with functional cells. It's just filling the holes. So it loses specialized function. Like in the skin, scar tissue doesn't sweat and there's no hair growth. And with a new scar, you have to be careful to make sure you have it covered or you have sunscreen on it because it also doesn't have the cells that are going to respond to UV light to protect it, melanin cells, in other words. It has reduced elasticity and strength, and there's a potential for contractures. We can, with PT interventions, minimize scar tissue formation if we do it appropriately, and we will learn about that. So when you have a cardiac scar, you have reduced cardiac pumping ability. When you have lung scar, you have reduced expansion capacity because that scar tissue is not going to expand like the lung tissues do. When you have a skin scar, you have loss of sensation, maybe not usually just on the scar, but sometimes on the tissue around it as well because nerves were damaged during the wounding process. And you also have loss of flexibility with a skin scar. So there are some factors that promote healing and there are some factors that impair healing. So for promoting healing, good nutrition, protein, vitamins A and C, and zinc are important for healing. I often will say to patients, are you getting enough protein? And they're recovering from surgery. Here's a recipe for a protein shake or whatever, you know. Adequate blood supply. We talked about that. Appropriate age. So people, like little kids, heal fast, and elderly people don't heal as fast. If you don't get infected, then that promotes healing. If you have proper wound care to prevent infection or other things, and we will have a whole section on wound care. If inflammation is controlled and you don't get into chronic inflammation, that also promotes healing. The things that might impede healing, diabetes mellitus, it's a metabolic disorder that affects the small blood vessels, and so it affects your circulation and it slows your healing. Smoking. I don't know if you know about this, but smoking's bad for you. I will rail on about smoking. I remember from a long, long time ago when I was in grade school, somebody came to speak to us about the dangers of smoking. So it's been known for a long time. I was in grade school a long time ago. And I remember it was such an impression that it made on me. They handed out a little plastic case that had a cross section of a healthy lung, and then the next one that came around was a cross section of a smoker's lung. And that made such an impression on me as a kid. I was like, I don't want my lungs to look like that. But in case you didn't know it, smoking is bad in a lot of ways. And here's one of the ways it impedes healing. Certain medications, like steroid medications and chemotherapy, impede healing. We will find out in the next chapter. Steroid and chemotherapy can also impede your immune response. Poor nutrition, if you're not getting the adequate nutrients to heal those wounds, then that's going to impede healing. If you're very old, things don't work as well. It's harder to heal. If it's infected, it's harder to heal. Excessive movement or stress on the wound. So, say that we just had knee surgery and we're just really pushing that range of motion. We're putting a lot of stress on that incision. That is going to actually impede healing. And there are many a time in the clinic where I've said to people, it's like, it's great that you're exercising 5 times a day. However, you might be shooting yourself in the foot and making it harder for you to heal. So you want to exercise enough, but not too much. So our interventions that we do in PT are going to change based on the healing phase. And we're going to talk more about this in upcoming classes, like so much that it'll become part of your brain structure. But in the acute inflammatory phase, we're going to use the Price protocol, protection, protection, rest, ice, compression, and elevation. You can do gentle passive range of motion within the limits of pain, and it might be more in the acute inflammatory phase. The patient education, that's a big deal. We're always doing that, but super important in the acute inflammatory phase. Like I said, I'm telling my patients, yeah, that's great that you're exercising that much, but maybe you're not doing yourself a favor. Tell them the appropriate times and the appropriate way to increase their exercise level. You want to avoid aggressive exercise, heat during the acute inflammatory phase. Massage, you don't want to massage over the inflamed area. So once you move into the proliferation phase, you can start with progressive loading, gentle strengthening, scar tissue mobility. So how do we know when we're in the proliferation phase? We're going to see that pink granulation tissue. We're going to see evidence of healing. The acute inflammatory symptoms, those 5 cardinal signs, are going to decrease. Um, you can begin more active interventions at that point. When you're in the maturation phase, when the scar is now remodeling into its mature phase, and that goes like from now until forever, you can do progressive strengthening, functional activities. You can work on scar tissue remodeling techniques, which we'll learn in another class. And your goal is to return to your prior level of function. That makes sense, right? So when do we modify it or stop the treatment? What's our red flag? So if you get increasing pain during or after treatment, you want to modify, not necessarily stop, but modify the treatment. If you get increased swelling or inflammation, you need to modify. Signs of infection like fever, red streaking, purulent drainage, so that's pus. That means that's infection. And then you want to refer them right back to their doctor if they're post-surgical. That is serious and needs to be addressed immediately. A lot of times I'm on the phone with the doctor's office, like, I'm going to text you a picture of the wound. Here's what it looks like. Here's the measurements. And they get them in that day because it's important. If somebody's excessively fatigued, they're putting their body under a lot of stress. They are not, that it's going to impede healing. if they have new or worsening symptoms. So always, always, always keep the lines of communication open and report your concerns to the supervising PT immediately. There's no reason why you can't also report them to the physician if it's appropriate, if they're post-surgical or something like that. And in fact, you often do. So keep those lines of communication open. Everybody has to know what's going on in order to optimize treatment for this person. So here's our case study. We have a 45-year-old construction worker who's 2 weeks post rotator cuff repair. So 2 weeks, what type of healing is occurring? So we're probably into our proliferation phase. We probably can maybe still have a little bit of inflammation going on at 2 weeks. They're probably in a protected phase. Look at him; he's got his arm in a sling to protect him. When what interventions are appropriate? A lot of times, surgeons will have a particular protocol, or the facility that you work in will have a particular protocol. Like in the first week, you're going to do this. In the second week, you're going to do this. In the third week, you're going to do this. So you might need to avoid certain actions. After rotator cuff repair, sometimes people are limited to 0 degrees of lateral or external rotation. So you should know what you need to avoid and what factors might complicate healing. This is a great time for patient education. Tell them what they need to avoid at home. How can they facilitate their healing? So the Think, Pair, and Share is for a live class where you get together with a partner and talk about it for 3 minutes. But you can talk with your classmates. You can get on your Discord and talk about it, or you can just think about it and compare the type of healing to what we talked about. So in the next chapter, we are going to talk about the next step in the protection of our cells, which is the immune system, which is very interesting. We always want to know when we're dealing with inflammation, what type of tissue damage occurred, what phase of healing the patient is in. Are there signs of acute inflammation? If so, we need to back off a little bit, probably with our interventions. What factors might affect healing, either to impede it or to promote it? What interventions are appropriate for the phase that they're in, and what interventions should be avoided? And when should I contact the supervising PT or the physician? So very important things to think about when you are approaching someone experiencing inflammation. So our key takeaways: inflammation is necessary for healing, but it needs to be managed appropriately so it doesn't develop into a chronic issue. Acute inflammation requires different treatment from chronic inflammation. And understanding healing phases guides our intervention selection. We will talk more about this in upcoming classes. How do you recognize what phase somebody's in? And we're going to talk very specifically about that. Patient factors significantly impact healing outcomes. So there are things you can't control, like chemical processes and whatever, but there are things that you can do to significantly impact your outcome. So when in doubt, you're going to err on the side of caution, do less than you think the patient can, and consult with the supervising PT if necessary. You need to understand these processes because it directly impacts patient outcomes and safety. Important things to think about.